Water is life. We all know this. But what happens when the water we drink contains something harmful? Something we can't even see, taste, or smell. Uranium, a naturally occurring radioactive element, is one such concern. It can seep into our groundwater from rocks and soil, posing a potential health risk. Determining safe levels of uranium in our drinking water is crucial for protecting public health. For decades, scientists and policymakers have grappled with this issue. How much uranium is too much? The answer, it turns out, is complex and constantly evolving with new research. Recently, a groundbreaking study by the Bhabha Atomic Research Centre in India has shed new light on this critical issue. After years of rigorous research, BARC has concluded that a uranium concentration of 60 micrograms per liter in drinking water is safe for human consumption. This finding is significant because it challenges the previously held notion that lower levels of uranium are always safer. BARC's research involved extensive analysis of health data and long-term exposure studies. The results indicate that 60 micrograms per liter does not pose a significant health risk. This is an important contribution to our understanding of uranium's impact on human health. BARC's findings, however, stand in contrast to the Bureau of Indian Standards' 2021 recommendation of a lower limit of 30 micrograms per liter for uranium in drinking water. The BIS, responsible for setting quality standards across various sectors, arrived at this limit based on international guidelines and a precautionary principle. The differing opinions between these two respected institutions highlight the complexity of the issue. While BARC's research suggests a higher limit is safe, the BIS advocates for a more cautious approach based on global standards. This disparity underscores the need for ongoing dialogue and collaboration between scientific research and policymaking. Section 4. A global perspective: uranium limits around the world. The debate over safe uranium levels isn't unique to India. Different countries have adopted different standards based on their own research, risk assessments, and available resources. For instance, the World Health Organization recommends a limit of 30 micrograms per liter, while the United States Environmental Protection Agency sets the limit at 30 micrograms per liter as well. These variations highlight the challenges of establishing a universally accepted safe limit. Factors like geology, population density, and water treatment infrastructure influence each country's approach. Section 5. The price of safety: health and economic considerations. The health implications of prolonged exposure to elevated uranium levels are a major concern. While low levels may have minimal impact, long-term exposure to higher concentrations can lead to kidney problems and an increased risk of certain cancers. Children with their developing organs are particularly vulnerable. However, maintaining extremely low uranium limits in drinking water comes at a cost. Advanced water treatment technologies required to achieve these low levels can be expensive, especially for developing countries. Balancing the costs of water treatment with potential health risks is a delicate act. Section 6. Localized solutions for a global challenge. The debate over safe uranium levels in drinking water is far from over. BARC's research provides valuable new data, but it's essential to consider the broader context of global standards and local conditions. Moving forward, a multi-pronged approach is crucial. Further research is needed to refine our understanding of uranium's impact on human health at various levels. Localized studies can help determine appropriate limits based on specific geological and environmental factors. Ultimately, ensuring access to safe and affordable drinking water requires a balance of scientific rigor, policy considerations, and community engagement.